Recent research shows that as we age, our digestion changes in surprising ways. And sometimes, the gas we pass can reveal serious health warnings we might never expect. Today, we're going to uncover 6 specific types of gas that every woman over 60 should pay close attention to. Some of them are harmless, but others may point to hidden issues in your gut, your liver, your blood sugar, or even your colon. In this video, I'll explain how silent gas might reveal food intolerances, why sulfur smells could point to gallbladder problems, how painful gas can be linked to your colon health, and even how the smell of your gas may give early clues about diabetes. You will also learn how your pelvic floor affects gas control, and why some gas may be a red flag for serious conditions that require immediate attention. Make sure you stay with me until the very end, because the first type I'll cover is the most serious and often the most overlooked warning sign. Knowing these signs could help you catch a problem early, protect your health, and feel more comfortable every day. Before we begin, take a moment to write your city in the comments below. I would love to see where everyone is watching from. And if you find this video helpful, please like the video and subscribe to Glowing Age. This helps me create more valuable lessons for you and others who are navigating this stage of life. Now let's begin. Fart number 6, the silent but frequent gas. Have you ever noticed that you seem to pass gas more often than you used to? And not the loud, embarrassing kind, but the quiet, almost constant type that seems to slip out throughout the day. Many women over 60 experience this shift, and it's not just an awkward part of aging. It could be your body's way of asking for help. As we age, our digestive system undergoes subtle but significant changes. The gut doesn't always process foods the way it did decades ago. The enzymes that once effortlessly broke down dairy, grains, and certain vegetables may become less active. As a result, undigested food particles can sit longer in the intestines, where they ferment and produce gas. This fermentation creates those small, frequent releases of gas you might be noticing. One of the most common culprits behind silent but frequent gas is lactose intolerance. Many people assume they've never had an issue with dairy, so they're surprised when yogurt or milk suddenly leads to bloating and gas. But the truth is, lactase production, the enzyme responsible for breaking down lactose, naturally declines with age. Even if you tolerated dairy your whole life, after 60, your body may struggle to keep up. Another growing issue is gluten sensitivity. You may not have full-blown celiac disease, but mild gluten intolerance can still trigger excessive gas, bloating, and discomfort. Wheat, barley, and rye contain proteins that some aging digestive systems no longer handle well, leading to inflammation and fermentation in the gut. Let's not forget about fiber. Fiber is essential for healthy digestion, but the type and amount matter. Suddenly increasing fiber intake, especially insoluble fiber found in whole grains and raw vegetables, can overwhelm your system. Instead of aiding digestion, it can trap gas and create that persistent, silent pressure you're trying to manage throughout the day. In some cases, frequent silent gas is linked to a condition known as small intestinal bacterial overgrowth, or SIBO. As we get older, changes in gut motility, the natural movement of the intestines, can slow down. This creates an environment where bacteria that should stay in the large intestine migrate into the small intestine. These misplaced bacteria feast on carbohydrates and fibers, producing large amounts of gas that escape quietly but often. SIBO is more common in older adults than many realize and can be effectively treated once identified. Even the medications commonly prescribed after 60 can play a role. Drugs for blood pressure, diabetes, or depression may slow digestion or alter gut bacteria, contributing to increased gas production. What seems like a minor side effect can quietly disrupt daily comfort. It's important to track your symptoms and look for patterns. Does the gas worsen after certain meals? Do you notice changes when you eat dairy, bread, or high-fiber foods? These clues can help pinpoint whether your body is reacting to specific triggers or if there's a larger digestive issue that needs attention. Silent but frequent gas isn't something you simply have to live with. Identifying the underlying cause, whether it's food sensitivities, bacterial imbalance, or medication side effects, can bring significant relief. And while it might feel uncomfortable to discuss, speaking openly with your healthcare provider can open the door to simple, effective solutions. Your gut may be aging, but it doesn't have to suffer in silence. When you listen carefully to these subtle signs, you're not just addressing an awkward symptom, you're protecting your overall health, comfort, and quality of life. Fart number 5, the sulfur bomb. Have you ever caught yourself surprised by a sudden, strong, rotten egg smell after passing gas? That unmistakable sulfur odor isn't just unpleasant. It may be revealing something important about what's happening inside your body. When gas carries a strong, sulfur-like scent, it often means your digestive system is producing higher amounts of hydrogen sulfide. While this gas is a normal byproduct of digestion, excessive amounts can indicate that certain foods or even underlying health conditions are disturbing your gut balance. One of the most common reasons for sulfur-heavy gas is difficulty digesting sulfur-rich foods. Eggs, garlic, onions, broccoli, cauliflower, and certain meats all contain sulfur compounds. For many people, these foods aren't a problem. But as we age, our digestive enzymes may not break these foods down as efficiently. This incomplete digestion allows bacteria in the colon to ferment these sulfur compounds, releasing hydrogen sulfide gas with that unmistakable odor. But diet isn't always the only factor. The gallbladder plays a critical role in digesting fats. As we get older, gallbladder function may become sluggish or impaired. Bile, produced by the liver and stored in the gallbladder, helps emulsify fats, breaking them down for proper digestion. If bile flow slows or gallstones develop, fat digestion suffers. This can lead to excessive fermentation in the intestines, contributing to foul-smelling gas that may be rich in sulfur. The liver also deserves attention here. A sluggish or overworked liver may not filter toxins and process bile effectively. If the liver struggles, digestion becomes less efficient, and the bacterial balance in your gut can shift. This bacterial imbalance may favor sulfur-producing microbes, leading to more of that rotten egg smell. Medications can sometimes play a role as well. Certain drugs, especially those that affect bile production, liver function, or gut bacteria, can inadvertently lead to increased sulfur gas production. Even something as common as long-term antacid use may disrupt stomach acid levels, affecting how food is broken down and digested. Less commonly, persistent sulfurous gas may be a subtle early warning of gastrointestinal infections or disorders, such as infections with bacteria like Helicobacter pylori, which can interfere with digestion and gas production. In rare cases, sulfur-smelling gas can be associated with malabsorption disorders, where your body struggles to properly absorb nutrients, leaving undigested food to ferment in the intestines. If you're experiencing frequent episodes of sulfur-rich gas, it's important to pay close attention to when it happens. Does it follow specific meals? Does it appear alongside other symptoms like bloating, cramping, or changes in your bowel movements? These details can help guide a healthcare provider in identifying whether diet, gallbladder function, liver health, or another issue is contributing. This isn't something to be embarrassed about. Instead, see it as your body's way of communicating. The sooner you address these sulfur signals, the sooner you can find relief, protect your digestive health, and enjoy greater comfort as you age. Fart number 4, the painful pressure gas. When gas brings not only embarrassment but actual pain, it's a signal you should never ignore. That sharp pressure in your abdomen, the twisting cramps that seem to build before and after passing gas. This isn't simply about what you ate last night. Painful gas, especially if it becomes a recurring pattern, can point to deeper digestive issues that become more common as we age. One of the primary concerns with painful gas in women over 60 is diverticular disease. Over time, small pouches called diverticula can form along the walls of the colon. These pouches are often harmless at first, but when they become inflamed or infected, a condition known as diverticulitis, they can cause severe pain, particularly in the lower left side of the abdomen. The trapped gas builds up behind these inflamed areas, creating intense cramping and bloating that may come and go or escalate suddenly. Diverticular disease is surprisingly common after 50 and continues to increase with age. A lifetime of low-fiber eating, constipation, and straining can contribute to the development of these pouches. As the intestinal walls weaken, gas struggles to move smoothly through the colon, creating that painful buildup many seniors quietly endure. But diverticulitis isn't the only reason behind painful pressure gas. Partial bowel obstructions, whether from scar tissue, tumors, or even narrowing of the intestines, can also cause severe gas pain. These obstructions prevent gas from moving freely, causing it to build up in pockets, leading to stabbing or gripping sensations that are hard to ignore. If gas pain is accompanied by nausea, vomiting, or inability to pass stools, it may indicate a more serious blockage that requires immediate medical attention. Another factor to consider is slowed intestinal motility. As we age, the natural muscular contractions that move food and gas through the digestive tract can weaken or slow down. This delayed movement allows gas to accumulate, pressing on sensitive areas and creating bloating and discomfort that can feel sharp and persistent. Certain foods may also trigger painful gas episodes in aging bodies. Beans, lentils, cruciferous vegetables, and high-fat meals can overwhelm the digestive system, especially if eaten in large amounts or without proper preparation. The undigested components of these foods ferment in the gut, producing gas that stretches the intestinal walls and triggers cramping. Even underlying conditions like irritable bowel syndrome, which can continue or even appear for the first time later in life, may contribute to painful gas patterns. IBS involves a combination of gut sensitivity, irregular motility, and sometimes mild inflammation, all of which can create spasms and painful bloating when gas accumulates. It's also important to consider hydration and physical activity. Dehydration can harden stools and slow bowel movements, trapping gas behind sluggish waste. Regular gentle movement, like walking, stimulates the intestines, helping gas to pass naturally before it builds into painful pressure. When painful gas becomes frequent, it's not something to dismiss as just part of aging. These symptoms offer valuable clues that something deeper may need attention, whether it's diverticulitis, bowel changes, food sensitivities, or gut motility issues. Addressing them early not only reduces discomfort, but also helps protect long-term digestive health. Listening to your gut's discomfort isn't about giving in to fear. It's about empowering yourself to stay informed, proactive, and in control of your well-being. Fart number 3, the uncontrollable surprise gas. You bend over to pick something up, you cough or laugh a little too hard, and suddenly it happens. A small burst of gas escapes without warning. You didn't feel it coming, you couldn't control it, and now you're left embarrassed, even if no one else noticed. This kind of uncontrollable surprise gas is far more common than most women over 60 care to admit. But it's not just about gas, it's often about muscle control. As we age, one of the most overlooked changes in the body involves the weakening of the pelvic floor muscles. These are the muscles that support your bladder, uterus, rectum, and the surrounding organs. Over time, childbirth, hormonal changes from menopause, and the natural loss of muscle tone contribute to their weakening. When these muscles lose strength, their ability to hold back gas diminishes, especially during sudden movements or pressure changes like coughing, sneezing, or laughing. Estrogen plays a crucial role in maintaining the health of these muscles and tissues. After menopause, when estrogen levels drop, the tissues of the pelvic floor can become thinner, less elastic, and more prone to weakness. This makes it harder to control the release of gas, even when your digestive system is functioning normally. This issue doesn't exist in isolation. Often, women who experience gas leakage also struggle with mild urinary incontinence. The same pelvic floor muscles that help control bowel movements are responsible for bladder control. If you find yourself leaking urine during physical activity or sneezing, there's a good chance your pelvic floor is also contributing to your gas control issues. But there's another layer to consider. Nerve function plays a role as well. With aging, nerve sensitivity around the rectal muscles may diminish, making it harder for your body to recognize when gas is approaching. This delayed signal gives you less time to tighten and control the muscles, leading to those unexpected and often embarrassing releases. Certain medical conditions can exacerbate this problem. Chronic constipation, common after 60, can stretch and weaken the rectal muscles over time. Repeated straining further compromises the integrity of the muscles involved in gas control. Similarly, surgeries involving the abdomen, hips, or spine may affect the nerves or muscles related to pelvic function. Fortunately, there are highly effective ways to regain control. Pelvic floor therapy, guided by trained specialists, can help you strengthen these critical muscles through targeted exercises. Kegel exercises, performed consistently, have been shown in numerous studies to significantly improve both urinary and gas incontinence in older women. In more severe cases, medical devices or minor procedures may offer additional support. Lifestyle adjustments can also make a difference. Managing constipation, staying physically active, and maintaining a healthy weight all contribute to stronger pelvic floor function. Avoiding foods that cause excessive gas buildup, such as carbonated beverages, beans, and certain fibrous vegetables, may also reduce the pressure that triggers leaks. It's important to remember that while occasional surprise gas can happen to anyone, persistent loss of control isn't simply part of getting older. It's a treatable issue, one that can dramatically improve your confidence, comfort, and quality of life when addressed directly. Your dignity and well-being matter at every stage of life. Understanding why these changes happen and what you can do about them puts you back in control. Fart number 2, the oddly sweet or fruity gas. There's a particular kind of gas that can catch people off guard, not because of its strength, but because of its unusual sweetness. If you've ever noticed a faintly sweet, fruity, or even slightly chemical scent when passing gas, it may seem harmless. But this unique odor can sometimes be your body quietly warning you of a much bigger issue: how it's managing blood sugar. For women over 60, changes in blood sugar regulation become more common. As the body ages, insulin sensitivity may decline. This means your body becomes less efficient at moving sugar from the bloodstream into your cells, leading to elevated blood sugar levels. In some cases, this can develop into prediabetes or type 2 diabetes. When blood sugar remains high for extended periods, the body begins to burn fat for energy, a process called ketosis. One byproduct of ketosis is acetone, a compound that carries a sweet, fruity odor. While this scent is often most noticeable on the breath, it can also be detected in urine, sweat, and yes, even in gas. That faint sweetness you're smelling may be the result of your body shifting how it processes fuel. But diabetes isn't the only potential culprit. Certain low-carbohydrate or high-protein diets, which some adopt for weight loss or blood sugar management, can also push the body into a mild ketogenic state. While these diets may offer some benefits, they can increase the production of ketones, adding a sweet or unusual odor to your digestive gases. Beyond ketosis, poor digestion of certain sugars, such as fructose or artificial sweeteners, can also produce gas with a sweeter scent. These sugars may not fully break down in the small intestine, passing into the colon where bacteria ferment them, releasing gas that carries a distinct, sometimes sugary odor. This is more common in individuals with fructose malabsorption, a condition that becomes more likely as gut function slows with age. Medications and supplements can sometimes contribute to these changes as well. Some drugs used for managing diabetes, cholesterol, or even certain vitamins may alter digestion or metabolism in ways that affect how gases are produced and how they smell. Although an occasional sweet odor in your gas may not be cause for immediate alarm, if it becomes frequent or is accompanied by other symptoms, such as fatigue, unexplained weight changes, increased thirst, or blurred vision, it may be time to speak with your healthcare provider. These could be early warning signs of metabolic changes that deserve prompt attention. Early detection is key. The good news is that many blood sugar issues can be managed, and sometimes even reversed, through lifestyle adjustments, proper medication, and careful monitoring. Dietary changes, increased physical activity, weight management, and regular medical checkups all play a vital role in keeping your blood sugar within a healthy range and preventing complications. While it may feel awkward or uncomfortable to bring up changes in gas with your doctor, Doing so could provide critical information about your body's internal balance. These small signs, often dismissed as nothing, can sometimes offer the earliest clues that your metabolism needs support. Your body speaks in many ways. Paying attention to even the subtlest changes allows you to take charge of your health, protect your energy, and enjoy the vibrant years ahead with greater confidence and peace of mind. Fart number 1, the persistent, foul, and unrelenting gas. When gas becomes a constant companion, foul, frequent, and seemingly impossible to control, it's more than just a nuisance. Persistent, unrelenting gas with a strong, offensive odor may be a sign your colon is trying to tell you something far more serious. And for women over 60, this kind of warning must never be ignored. As we age, the risk for certain gastrointestinal conditions naturally increases. One of the most concerning possibilities behind chronic foul-smelling gas is the presence of polyps or even early-stage colorectal cancer. These abnormal growths in the colon can interfere with normal digestion and the smooth passage of waste. When food moves too slowly through the intestines, bacteria have extra time to break it down, producing large amounts of gas with a particularly strong and offensive odor. The problem isn't just the smell, it's the persistence. If you notice that even simple meals lead to excessive, foul gas that lingers day after day, especially when combined with changes in bowel habits, such as constipation, diarrhea, narrowing stools, or blood, it's critical to seek medical evaluation. Catching issues like polyps early can prevent far more serious problems down the road. But colorectal issues aren't the only concern. An imbalance in your gut microbiome may also be responsible. Over time, antibiotic use, poor diet, stress, and certain medications can shift the balance of bacteria in your digestive tract. When harmful bacteria outnumber the beneficial ones, they can produce sulfur-rich gases and other compounds that lead to that constant, offensive odor. Small intestinal bacterial overgrowth, or SIBO, is another condition that becomes more common with age and may contribute to persistent gas. In SIBO, bacteria that belong in the colon migrate into the small intestine, where they ferment food too early in the digestion process. This leads to bloating, cramping, and foul-smelling gas that seems relentless and resistant to dietary changes. Certain malabsorption syndromes, such as celiac disease or pancreatic insufficiency, may also create ongoing digestive issues that produce continuous, unpleasant gas. When the body fails to fully break down and absorb nutrients, undigested food becomes fuel for gas-producing bacteria, making the problem worse over time. Even seemingly minor factors like dehydration, low stomach acid, or inadequate chewing can contribute. When food isn't properly broken down early in digestion, it arrives in the intestines partially intact, offering more material for fermentation and gas production. While occasional bad-smelling gas happens to everyone, the key warning sign here is its persistence. If foul gas continues for weeks or months despite efforts to adjust your diet, and especially if it's accompanied by other digestive symptoms or unexplained weight loss, you must take it seriously. The good news is that many underlying causes of persistent foul gas are treatable, and early detection offers the best outcomes. Colonoscopies, stool tests, breath tests for bacterial overgrowth, and blood work can provide clear answers. And the sooner you uncover the root cause, the sooner you can begin effective treatment. Ignoring these signs out of embarrassment or fear is never the right choice. Your gut is one of your body's most reliable messengers. By listening to these uncomfortable signals, you protect not only your digestive health but your overall well-being and longevity. Your story doesn't end because your body changes. It continues, with wisdom, with care, and with the confidence that comes from facing every challenge head-on. You've now learned the 6 types of gas that could carry important messages about your health. Remember, most gas is harmless, but persistent changes deserve your attention. Your body knows how to speak to you. The key is knowing how to listen. If you've experienced any of these symptoms, don't ignore them. Talk to your doctor, track your patterns, and take steps early. Small actions today can protect your well-being for years to come. If this video helped you better understand your body, Please like the video and subscribe to Glowing Age. Your support allows me to continue sharing these important lessons, helping you and others live healthier, stronger, and more confident lives after 60. Take good care of yourself. I'll see you in the next video.